Good afternoon. I'm Justin Flexi, the founder of CareChronicle. This is John. He was recently diagnosed with heart failure. His physician gave him a list of lifestyle modifications and medications to take, but John didn't understand why. He's a high school graduate, but he didn't understand the language that his provider was using. Understandably, he was overwhelmed. He didn't take his medications, and he was quickly readmitted to the ER. John's story is common, as more than 50% of Americans lack the requisite health literacy to successfully navigate our health system. They are at a substantially elevated risk of morbidity and mortality. They consume more ED resources. They're much more likely to be readmitted, and they consume more provider time, often unreimbursed. The good news is that health literacy investments work. A Mayo Clinic analysis found that reducing the grade level readability of discharge instructions resulted in a decrease of patient-initiated messages and a staggering 80% decrease in emergency room visits. The bad news is that this is not a scalable process. We founded CareChronicle to change that narrative. We're transforming complex medical documentation like notes or discharge instructions into manageable steps for patients like John. We're increasing patient engagement with AI-tailored notifications and education personalized to every single patient. I'm joined by an incredible team from some of the best companies on the planet. I myself have over a decade of experience in B2B software as a service product management in life sciences. And we believe that now is the time to strike on health literacy. The average hospital has a negative operating margin. Provider burnout is at an all-time high, and the transition to value-based care is accelerating. Simultaneously, there are some exciting changes in AI tech, specifically retrieval augmented generation, that are opening doors that weren't even possible a month ago. Now, the cost of this is about $2,500 per admission, or $4.5 million to an average hospital. If we target large Epic and Cerner sites, that represents about $5 billion in opportunity. I'm seeking mentorship in this space, specifically regulatory expertise. And our business model, as I alluded to, will be B2B software as a service, initially into hospitals. We want to pilot with an equally entrepreneurial health system to sort of validate what we're saying and get documented outcomes and show how we're helping adhere to value-based care. Thank you.
Great. Great presentation.
Thank you.
I was just curious. Obviously, LLM model,
Yeah.
it's a very hot topic right now.
Yes.
So I was curious, with all the competition out there, how does your solution differentiate from other groups that are working on this?
Definitely. I think 2 weeks ago I didn't know, and as I'm sure everyone here knows, there's been a bit of a black swan event in the industry showing the instability with OpenAI, and now Microsoft. Sam Altman's out, he's in. I've always been a proponent of having an agnostic platform, so we're looking into open source technologies. But the plan is to play with all of the existing providers of LLMs on top of something like Llama 2 or Alpaca, and anyone can do prompt engineering. I think with retrieval augmented generation, sort of decreasing the cost of like what's fine-tuning a model, there's a bit of a first mover advantage and a follower event going on right now. So it's sort of imperative to be here today. And I have one more addendum I'll add. It's not just the prompt engineering, it's a matter of doing a human in the loop, partnering with the health system and getting documented outcomes, which are the most important thing when selling into a healthcare system. No one cares how cool your tech is, they want to know who else bought it.
Thank you for your pitch. Could you speak a little bit to any of kind of risk or liability for oversimplification of discharge instructions?
Certainly, I think it's ultimately a trade-off. In a perfect world, we have infinite knowledge and infinite time, and you're trading some of that knowledge for greater adherence. So that would have to be something that's opted into. I'm getting around that initially by having a provider in the center. So this will initially go into education departments, then deploy these tailored levels of discharge instructions for each provider. As we sort of move through this life cycle, we'll do software as a medical device to get the approval to solve exactly what you're saying. But right now, someone else will inherit that attestation.
And just can I have a real quick follow-up? If you are doing that trade-off between all of the knowledge and perhaps the risk of oversimplification, how do you ensure that there's not bias in who gets the oversimplified version of discharge instructions?
Certainly. I think there's two steps. Initially, we'll do levels. So there'll be 4 levels of simplification. And, that will be working with a provider by provider system basis. So they'll sort of define that alongside us. In the future, it's not just LLMs, which aren't infinite. You'll be doing something like regression analysis or like gradient boosting and taking in social determinants of health, demographics, their own patient messages, and then that will inform the model that serves these modified discharge instructions. But ultimately, we're going to empower the provider, reduce the time they spend, and give them a better choice to offer to the patient.
A quick question. I know we don't have much time left, but to follow on to Katie's line of discussion,
Yeah.
the oversimplification strikes me as a risk that could be offset with a human element.
Absolutely.
Is there any plans to integrate this, so rather than just a pure AI care instructions, but integrated with a care follow-up or a care team?
100%. Yeah, initially I wanted to go to the care team or, if present, the education department. They'll curate that. We'll work with the care team, approve everything. So we'll have their buy-in before we serve any of this. I think, as you said, there's a lot of risk in just pushing AI notifications out into the world. Everything will be accepted by the provider institution, and getting what you've proposed, you would need a software as a medical device clearance. So, yeah, thank you.